Welcome back for the lecture series of RBC Pathology. This is the last part of the video lecture series, and we will tackle the highlighted topics for this slide. So in Rodax, gumawa siya ng table para daw mas easy natin maklasify yung mga different types of hemolytic anemia. So we can classify them primarily in the mechanism, either intravascular hemolysis versus extravascular hemolysis. Okay? And then, pwede rin daw natin sila i-classify according to the defects. Extrinsic defects versus intrinsic defects. So, ang hati dyan, hanggang doon sa spur cell anemia. Okay? Magmula sa taas hanggang doon sa spur cell anemia, extrinsic defects daw sila. Intrinsic naman from paroxysmal, including dyan ang membrane defects hanggang doon sa hulihan. Yan yung mga intrinsic defects, And then, another classification is according to acquired versus hereditary. So, yung acquired, from dun sa first condition hanggang dun sa paroxysmal nocturnal hemoglobinuria, included yan lahat sa acquired type of hemolytic anemia. Ang mga hereditary, or this will include, it follows a Mendelian inheritance, Start tayo dito sa hereditary membrane, pababa. Okay? Another, ang daming alam ni Rodax, right? Another classification is yung, mechanism of RBC lysis due to the abnormalities inside or outside RBC. So, dito, yung mga outside sa RBC, okay, itong first column natin and the second column, sa first part of the table, membrane abnormalities naman, itong tatlo, and lastly, yung pinakaloob na, the RBC interior, including the hemoglobin and the enzyme. Another classification, is by classifying them according to timeline, kung acute ba sila or chronic. So, in green text daw yung mga may acute pattern of hemolysis, In red text naman yung mga chronic hemolysis. Okay? Kung magaling ka in visual learning, madali ito para sa'yo, Hanggang saan yung mga defects natin, saan banda si hereditary membrane, okay? So, paano ito aaralin? So, halimbawa, which of the following is an extrinsic anemia has an extrinsic defect, okay? So, pipiliin nyo kung alin lang doon yung may extrinsic defect. Halimbawa, option natin, letter A, membrane defect, B, PNH, C, gawin natin babesiosis or malaria, D, G6PD. So, lahat ng yon halos intrinsic except the babesiosis or malaria, which involves extrinsic. So, ganito mag-aral, regarding dito sa table na to. Pero, if in case na hirap kayo sa table na to, we can break this down into much simpler discussion. Unahin natin, yung classification between extravascular versus intravascular. So, recall lang natin, extravascular is also known as your macrophage-mediated hemolysis, while yung intravascular hemolysis is also known as RBC fragmentation hemolysis. Okay, balikan natin yung mga conditions under each classification. Extravascular, ibig sabihin ulit nito, nasa labas ng vessel yung hemolysis process. Ibig sabihin, most of the hemolysis can happen inside which organ? The spleen. Kasi ang spleen is the major organ for the destruction of old or damaged RBCs. So, ano yung mga condition na yan? Number 1, may membrane defects. Kung maalala nyo yung topic natin back in midterms, ang mga membrane defect is number 1, spherocytosis, elliptocytosis, ovalocytosis. Okay, babalikan naman natin yan mamaya. The next, your drug-induced hemolytic anemia. Okay? Next, immune hemolysis by warm antibodies, most especially during Rh incompatibility. Okay? And then, dito tayo sa intravascular. Mga enzyme disorders, anong halimbawa nito? Your pyruvate kinase deficiency and G6PD deficiency. Okay? Take note lang natin that G6PD can present in both mechanism. No? Discuss lang natin muna dito. G6PD can be intravascular sa loob ng blood vessel. Okay? Kapag nagkakaroon ng autohemolysis when exposed to triggers such as your intake of fava beans and intake of sulfur-containing drugs. Okay? Pwede rin silang extravascular kapag pumunta yung RBC sa spleen and therefore kakainin niya yung Heinz bodies present sa loob ng RBC. Okay? So, pwedeng dalawang mechanism sa G6PD. Okay, going back to the other conditions. Globin chain disorders. So, ang mga halimbawa nito are your number 1, hemoglobin S present in sickle cell anemia and thalassemias. Next example of conditions are your microangiopathic hemolytic anemia. Micro means small, angio means blood vessels. So, small vessels ang may problem dito. PNH, again, basa nyo ito kanina, right? PNH stands for paroxysmal nocturnal hemoglobinuria. And ano ang defect or deficient dito sa PNH? It has a deficient CD55 and CD59. And lastly, one example of intravascular hemolytic anemia is immune hemolysis caused by cold antibodies such as in EBO incompatibility. So, magpapalito sa dalawang ito. Okay? Extravascular warm antibodies, intravascular cold antibodies. Next topic naman, the laboratory findings for the differentiation of hemolytic anemia. Diba dun sa ating first part of the hematology topics in SEM 1, na-discuss natin yung difference between intravascular hemolysis and extravascular hemolysis. Recall lang natin, no, the other name for intravascular hemolysis is RBC fragmentation lysis. And yung extravascular naman is macrophage-mediated hemolysis. Okay. Generally, ang mapa-appreciate mo sa kanila, no, dahil lumalabas lahat ng hemoglobin out of the RBC due to hemolysis, yung ating mga byproducts na bilirubin and urobilinogen are both increased. Okay? Reticulocyte count then is increased to compensate for the RBC loss. Okay? And then, RBC, hematocrit, and hemoglobin are all low in levels dahil meron nga tayong ongoing anemia. So, the next part, yung mga differentiating features natin. Haptoglobin is low in intravascular dahil yung mga free hemoglobin will attach to your haptoglobin. Hindi ginagamit ang haptoglobin sa extravascular catabolism. So, normal dito. Hemopexin levels naman is increased in intravascular pathway. Normal sa extravascular pathway. Bakit kaya? Naalala nyo yung hemopexin, haptoglobin, methylalbumin salvage system Nangyayari lang yon in intravascular hemolysis. During that pathway, tumataas ang level ng hemopexin due to the conversion of your hemoglobin to hemopexin. Methemoglobin naman, present lang kay intravascular, absent kay extravascular. Methemoglobin is from the salvage system, kung maalala nyo doon sa first lecture natin. Free hemoglobin naman, present lang kay intravascular dahil sa loob mismo ng blood vessel, pumuputok ang RBC. Walang free hemoglobin sa extravascular dahil nangyayari lang ang lysis in the spleen. Sa peripheral blood picture naman, mas maraming schistocytes na ma-appreciate in the PBS. Sa intravascular, extravascular naman, mas maraming spherocytes. In urinalysis din, mas ma-appreciate mo yung dark urine due to hemoglobinuria sa intravascular catabolism. Extravascular catabolism, walang dark urine dahil walang hemoglobinuria. We can further classify hemolytic anemia by classifying them according to the defect. Intrinsic defect includes those or problems in RBC membrane and even dun sa pinakaloob, the RBC's hemoglobin. Sa extrinsic naman, may problema outside the RBC. Okay? So, anong mga conditions na pwede natin i-classify per group? Dito tayo sa intrinsic defect. Okay, number 1, membrane defects. Again, anong mga example dito? Spherocytosis, elliptocytosis, ovalocytosis. Enzyme deficiencies, pyruvate kinase, and G6PD deficiency. Hemoglobinopathies, yung example dyan, sickle cell anemia and thalassemia. And yung PNH stands for paroxysmal nocturnal hemoglobinuria. The next, extrinsic defects naman. Pwede dyan ang macroangiopathic hemolytic anemia. Macro means big, angio means blood vessel. So, this refers to defects of the big vessels, most commonly seen during prosthesis. Okay? Microangiopathic hemolytic anemia naman. Micro means small, angio means blood vessel. So, smaller vessels ang may problema dito. Most commonly seen in TTP and HUS. What is TTP? Thrombotic, thrombocytopenic purpura. HUS is hemolytic uremic syndrome. Infections naman tayo. Pwede dyan ang mga malaria natin, which is major cause ay yung mga Plasmodium species. Parvovirus B19, which can cause aplastic anemia, lalong-lalo na sa mga bata. And it can produce lap-cheek appearance in physical examination. And babesiosis caused by causative agent called Babesia microti. In addition to that, meron tayong mga antibodies, present outside the RBC which targets the RBC membrane. So, either cold or warm. Ano nga ulit ang may cold antibodies? ABO, mga ABO antibodies. Ang sa warm, yung mga RH antibodies. Okay. Acute blood loss versus chronic blood loss. Again, according to timeline yan. Pag acute, less than 3 months. Pag chronic, more than 6 months. So, anong mga condition ang nagpo-produce ng episodic or acute blood loss? Number 1, yung mga microangiopathic. So, yan yung mga TTP and HUS. Immune hemolysis, both cold and warm, can cause acute hemolysis. PNH, enzyme disorder, such as in G6PD and pyruvate kinase deficiency, drug-induced hemolysis, and infections. Chronic naman, dito, macroangiopathic. So, kung papa dito, pag acute blood loss, mabilisang blood loss sa microangiopathic, matagalang blood loss sa macroangiopathic. Okay? In addition to that, no, meron din chronic hemolysis during hemoglobinopathies. Yan yung mga sickle cell anemia and thalassemia, plus your membrane defects. Okay. Acquired versus hereditary naman. In terms of time pattern, no? Ang mga acquired RBC defects, ma-appreciate o mapapansin mo lang sila during adult age group or late onset ang tawag natin, no? Pagdating niya sa ganitong age pa lang, no? Madalas yung mga young adults pa taas, okay? Ang hereditary naman, early onset, pwede mo silang screen through newborn screening test. Okay? Bata pa lang, newborn pa lang, meron na silang mga ganitong RBC defects. So, ano yung mga conditions under each group? Yung mga acquired RBC defects can be caused by the following. PNH. Bakit may asterisk tong PNH? Remember, PNH has genetic defect, no? Pero bakit hindi yan agad nakikita during newborn stage? Kasi itong PNH, medyo kakaiba, no? Na-acquire sila as the patient grows or matures. So, ma-appreciate mo pa lang yung eventual effect ng decrease CD55 and 59 pagtanda pa lang niya. Okay? And then next, yung mga acquired din, no, micro and macroangiopathic hemolytic anemias, immune hemolysis, okay? Yun na-acquire nila yung ABO antibodies and RH antibodies from their mothers, okay? Drug-induced and infections. Hereditary lang, tatlo lang ang tatandaan natin, okay? Membrane defects, ano yung mga under dito? Ulitin lang natin, no? Yung mga spherocytosis, elliptocytosis, and ovallocytosis. Enzyme disorders, G6PD and pyruvate kinase, and hemoglobinopathies, all of which can present at newborn stage pa lang. Okay. Disorders of RBC enzyme or enzymopathies. So, unahin natin, no, the most common enzyme deficiency of the Embden-Meyerhof pathway is the pyruvate kinase deficiency. This type of RBC defect is also considered as the most common form of hereditary non-spherocytic hemolytic anemia. Okay? Halos kasi halos lahat ng membrane defects is caused by spherocytosis. And this type, no, ito lang yung non-spherocyte form na kayang mag-cause ng hemolytic anemia. Ano ba yung implication kapag bagsak ang pyruvate kinase? 'Di ba? Ang Embden-Meyerhof pathway is the supplier of the majority of the RBC energy. Okay? Pag wala kang PK or pyruvate kinase, bagsak din ang ATP levels mo or the energy levels. And at the same time, no, it disturbs the level of your 2,3-DPG. It will cause an increased level of this. Therefore, kapag increase ang 2,3-DPG, anong ibig sabihin yan? Mas nag-release or nawawala agad yung oxygen or mas madaling bumitaw ang oxygen from the hemoglobin. Under PBS or peripheral blood smear, anong mga ma-appreciate mong poikilocytes kapag meron kang PK deficiency? You can appreciate acanthocytes or in other books, ang ibang pangalan niya, Thorn cells or spur cells. So, ito yung itsura ng acanthocytes. Meron kaming mnemonics before, no? Madaming kanto ang acanthocytes. Okay? Halos kamukha niya ang aling poikilocyte. Halos kamukha niya yung Burr cell. Okay? Pero this time, mas elongated or mas mahaba yung mga projections ng acanthocyte as compared to your burst cells. Next, enzymopathy is your G6PD deficiency. This is the most common enzyme deficiency naman ng hexose monophosphate shunt or the pentose phosphate pathway. Okay? Out of all deficiencies of the RBC biochemical pathway, ito yung most common na RBC enzyme. Kaya included siya sa newborn screening testing. Sa PBS naman, peripheral blood smear, anong ma-appreciate mong mga poikilocyte or RBC inclusion? Pwede kang ma-appreciate ng Heinz bodies and bite cells. Sa bite cells, no, mangyayari lang yan kapag dumaan ng RBC sa spleen. And ma-recognize ng spleen mo yung mga inclusion bodies. So, tinatry niyang kagatin, no, out of that RBC. Kaya meron kang ma-appreciate na bite cells. So, hindi rin naman laging bad news ang G6PD because it confers resistance against malaria. Remember, your Plasmodium species, mahilig yan sa mga perfect RBC, no? Mga magagandang RBC. Kapag merong ganitong defect ang RBC mo, hindi sila madalas nakaka-infect ng mga ganitong type of RBCs. Okay, so oxidative stress naman, it may be caused by infections, no? Ito yung most common cause. MCC is most common cause, okay? Most common cause of hemolysis in G6PD kapag nagkakaroon sila ng bacterial infection, no? Another is favism kapag nakakain ng fava beans. Yung mga nag-i-intake ng mga malarial drugs, okay? Ano ba yung mga example ng mga malarial drugs? Ito yung mga chloroquine, primaquine, okay? And sulfur-containing drugs. Okay, in G6PD deficiency, there is associated reduction of your NAD and reduced glutathione. Itong dalawang ito has an important role for neutralizing free radicals and oxidative stress. Okay? Kung wala ka nito, prone ka sa damages done by your free radicals, no, and oxidants. And then, therefore, yung ating hemoglobin is predisposed for oxidation. Magkakaroon ng precipitation, and then there is a eventual formation of your Heinz bodies. Remember, yung Heinz bodies natin are inclusions formed by the precipitated hemoglobin. And kapag yung Heinz bodies na nasa loob ng RBC are beaten off by our spleen macrophages, no? So, magkakaroon tayo ng poikilocyte called bite cells. And tong bite cells na to, once released through the bloodstream, madali na siyang ma-hemolyze or mag-burst out. Okay. Balikan lang natin yung formation of the bite cells. Okay? So, halimbawa, ito yung RBC. And for example, ito yung splenic macrophages. So, kakainin niya yung any damages formed inside the RBC. So, for this example, yung Heinz bodies, which is a damaged hemoglobin, no? Precipitated hemoglobin. So, kakainin to ng macrophages, forming a bite formation. Okay? Kaya ang tawag natin dito are your bite cells. So, another example of conditions under intrinsic RBC defects are the problems of RBC membrane. So, remember the difference between your vertical membrane proteins and horizontal membrane proteins. Balikan natin ha. Vertical membrane proteins are also called as integral proteins. And horizontal membrane proteins are your peripheral proteins. Okay? So, kapag may problem in vertical membrane proteins, prone sila magkaroon ng problem with the surface area. So, nagkakaroon ng decreased surface area, no? Lumiliit yung cell, pero na-maintain yung normal volume. So, therefore, maliliit yung ang supposedly maliliit na cell na pupuno ng hemoglobin, okay? So, ang expected laboratory result nito is increased MCHC. Remember, yung mga hyperchromic anemia, ano ulit ang perfect example ng mga yan? Ito yung mga spherocytes natin. Okay? Yung mutations naman ng horizontal membrane, specifically yung spectrin and protein 4.1, ma-appreciate mo sa mga elliptocytes or yung mga pencil-like RBCs natin. And the next membrane defect is what you call pyropoikilocytosis. Dissect natin yung name. Pyro means heat. Okay? Poikilocyte means variation of the shape. Nagkakaroon ng variable RBC shapes kapag na-expose ang RBC to high temperatures. Such as, magsa-start yan at temperature of 45 degrees Celsius or higher. Okay? Then next, ovalocytosis naman. So, ovalocytosis, meron tayong problem with TP band 3. Okay? Causing rigidity. Very rigid or very hindi flexible yung RBC membrane, hindi nakakalusot sa mga maliliit na capillaries. And hindi rin laging bad news for this type of condition kasi it confers protection against malaria. So aside from G6PD, nagkakaroon din ng protection against malaria sa ovalocytosis. And then lastly, stomatocytosis. Ang layman's term dito is lip-like RBCs, no? Mukha silang mga lips under microscope. So, anong meron dito sa stomatocytosis? It has a defect of membrane permeability to both electrolytes such as sodium and potassium. It is also associated with RH null. Ano bang ibig sabihin ng RH null? The absence of RH antigen in the RBC membrane. So, kapag type O ka with RH null, ano ang nomenclature doon? O negative. Okay? So, walang RH antigen present sa iyong RBC membrane. The next group of tests is to test for the membrane integrity. Okay? Ang most common na ginagamit in laboratory is osmotic fragility test. In this test, you expose your blood cells to a series of tube na pataas ng pataas yung hypotonicity. Ano bang ginagawa ng hypotonic environment sa RBC mo? Okay? Kapag hypotonic environment, it will swell your RBC and then kapag na-overswell na, puputok na sila, causing hemolysis. Okay? In this test, we make use of an heparinized blood specimen. Okay? To maintain para ma-prevent lang natin yung coagulation process. The reagent, sabi nga natin, hypotonic dapat ang reagent natin. So, it will range from 0.65 to 0.85% saline. Normally, ang RBC natin mag-hemolyze starting at 0.45 and then ang complete hemolysis is at 0.30% of saline. So, para ma-visualize natin, no? Compare natin hypotonic, iso, and hypertonic. Kapag hypotonic, una muna magsiswell and then mag-rupture. So, ito yung swelling of the RBC. Hindi mo na ma-appreciate yung kanyang donut shape, no? Yung central pallor niya. As compared to the hypertonic, shrink lang niya yung mga RBC. Okay? And then, therefore, um, yung, yung ating plasma membrane may release after the shrinkage. So, much better to test for the membrane is through hypotonic solutions. Okay, to interpret the results of your osmotic fragility test, meron tayong tinatawag na shift to the left and shift to the right. Okay? So, paano natin i-visualize yan? Okay, di ba kanina, previous slide, ang sabi natin, the initial hemolysis of a normal RBC starts at 0.45%. The complete hemolysis will be at 0.30%. Kapag merong shift to the left, ibig sabihin, mas fragile or increased fragility, yung increased membrane fragility, which happens in hereditary spherocytosis. Agad pumuputok at 0.65, no? And then makukomplete at 0.45. Kaya tinawag natin shift to the left, nasa left side siya ng normal or expected results. Okay? Dito naman siya shift to the right. Okay, na-move dun sa right. Ibig sabihin, decrease yung RBC fragility, which happens in IDA, thalassemia, and sickle cell anemia. So, magsa-start pa lang hemolysis at 0.35 and even at higher hypotonicity, baka hindi nyo ma-appreciate pa yung complete hemolysis. So, balikan lang natin, no, to visualize the results. Sabi nga natin, the spherocytosis, madaling pumutok. Right? Kasi nga, ang spherocytosis, madaming increase ng MCHC, punong-puno ng hemoglobin sa loob. Okay? Once na pumasok, kahit konting water lang sa loob, pumuputok na agad. Kaya meron tayong shift to the left or yun nga, increase ang RBC membrane fragility. In contrast with thalassemia, IDA, and sickle cell anemia, ito, target cell, most common sa mga thalassemia, okay? Walang laman yung mga yan, no? As kahit magpasok ka ng water dyan, hindi agad pumuputok yung RBC membrane kasi halos walang laman na hemoglobin yan sa loob. Let's proceed with microangiopathic hemolytic anemias, and most common example ng mga to are your TTP and HUS. TTP stands for thrombotic thrombocytopenic purpura. HUS naman, hemolytic uremic syndrome. Pagdating sa manifestation, halos parehas sila. It can present with microangiopathic hemolytic anemia and severe thrombocytopenia. Thrombocytopenia means bagsak ang levels of your platelets. Hahanapin mo ngayon yung another information, no, to finalize your diagnosis. Sa TTP, predominant dyan yung presence of your purpura. Ano ba yung mga purpura? Ito yung mga red to violet rashes sa skin caused by the bursting of your blood vessel. Dito naman, ang hahanapin mo is the acute renal failure. Di ba? From the name itself, no? Hemolytic uremic. May uremia. Ano bang ibig sabihin ulit ng uremia? Mataas ang levels of your BUN with clinical symptoms. Bakit tumataas ang BUN? Kasi pangit yung activity of your kidneys or meron ngang renal failure. Ano ang mga pathophysiology behind these two conditions? Punta tayo kay TTP. There is a deficiency of your ADAMTS13, which is an important protein for the activation of your von Willebrand factor. Ano ba tong von Willebrand factor? Saan ba siya importante? For the coagulation process. Sa HUS naman, it is primarily caused by Shiga toxin. Saan nanggagaling tong Shiga toxin? It is a toxin formed by your EHEC. Ano yung EHEC? Enterohemorrhagic E. coli. And yung strain number is 0157H7. So, tatandaan natin tong strain number ng EHEC, which is the primary causative agent of your HUS. Let's proceed with macroangiopathic hemolytic anemia. So, the primary example of this example, no, yung sa patient setting natin. Tingnan natin kung meron silang prosthesis. And kapag ang hemolytic anemia is caused primarily by their prosthesis, ang term dyan ay traumatic cardiac hemolytic anemia. Okay? Paano nagkakaroon ng hemolysis kapag may prosthesis? So, imagine natin, no, ang prosthesis kasi it's a foreign metal, no, na nilalagay dun sa heart valves. Halimbawa, dito sa example na to, okay, dadaan ngayon yung mga RBCs, pag-pass through nila dito sa foreign metal called prosthesis, nagkakaroon ng destruction of the RBCs. Okay? So, nagkakaroon ng hemolysis. And in peripheral blood smear, ma-appreciate nyo yung mga ganitong poikilocytes such as your schistocytes. Schistocytes are also called as helmet cells, no? Or fragmented cells. Pag durog na sila. Okay? Punta naman tayo sa immune hemolytic anemias. Okay? We can classify that into cold type and warm type. Ang cold type of immune hemolysis is related to IgM. Okay? So, para mas madali nyong matandaan, M for malamig. Okay? And then warm type for IgG. And then, ano ba yung mechanism behind this hemolytic anemias? Sa mga cold type of immune hemolysis, dumadaan sila ng intravascular pathway or RBC fragmentation hemolysis. Sa warm type of immune hemolysis naman, extravascular or through the spleen. Ang tinatawag, or in other books, ang tawag natin sa extravascular pathway is macrophage-mediated lysis. Okay. Bakit tinawag na cold type and warm type? The hemolysis will depend on the level of the temperature of the environment. Halimbawa, sa cold type, magsisimula pa lang ang lysis at 4 degrees Celsius. Sa warm type, magsisimula ang lysis at 37 degrees Celsius. Based on this information, alin dito ang mas delikado? So, mas delikado ang warm type immune hemolysis kasi normal body temperature natin ang 37 degrees Celsius. Okay? At normal body temperature, doon nagsa-start ang hemolysis. So, ito ang mas delikado sa mga RBC natin. Okay? Ano yung mga example ng mga cold type and warm type hemolysis? Tingnan natin sa cold type, no? ABO incompatibility. In ABO incompatibility, so ano ang patient setting natin dyan? The mother has type O and baby has either type A, type B, or type AB. So ano ang problem natin dito? Ang type O kasi has antibodies against A and B antigen. So kapag ang baby niya ay mayroong ganitong types, no, tatargetin ng antibodies ni mother yung mga RBCs ni baby. Therefore, nagkakaroon ng hemolysis kay baby. So, yan ang tawag natin dyan. Kaya ang tawag natin dyan ay ABO incompatibility. Okay? The next example for cold type is cold agglutinin disease caused by your bacteria called Mycoplasma pneumoniae. Recall natin back in bacteriology, ano ang diseases associated with Mycoplasma pneumoniae? It is associated with primary atypical pneumonia or walking pneumonia. Sa warm type naman, the predominant example for this is RH incompatibility. Kailan to nangyayari? So, explain lang natin. It almost always happen after the first pregnancy, no? Second pregnancy onwards, pwedeng magkaroon ng RH incompatibility. So, si mother ay RH negative and si baby ay RH positive. So, merong antibodies si mother against the RH antigen. So, tatargetin niya yung blood cells ni baby. So, therefore, yung hemolysis nangyayari kay baby, hindi kay mother. Okay. Dito tayo with hemoglobinopathies. Let's start with thalassemia. So first, i-discuss natin naman yung alpha thalassemia. Alpha thalassemia primarily caused by low or absent alpha globins. So we have 4 forms in this type of condition. Meron tayong silent carrier, alpha thalassemia minor, okay? And then hemoglobin H, and hemoglobin Barts. To discuss this further, okay, tingnan natin itong mga picture na to. Ang silent carrier, merong isang alpha globin chain deletion. So, nawawala ito, natitira na lang ito. Okay? Silent carrier sila kasi hindi naman full-blown yung manifestation ng anemia. So, kaya pa nilang tumanda without noticing the condition. Sa alpha thalassemia minor naman, merong deletion of the 2 alpha globin chain. Okay? So, meron na tong full-blown manifestation. No? Napapansin na yung clinical signs and symptoms. Sa HBH naman, meron 3 globin chain deletion. So, tanggal itong 3. Okay? So, ang meron dito sa mutation na to is HBH syndrome. Sa Bart's hemoglobin naman, yung 4 na normal globin chain, napapalitan ni gamma. So, meron tayong 4 gamma globin chain sa Bart's hemoglobin. And ito yung pinaka-severe type of alpha thalassemia. Kasi walang nagsusurvive dito sa condition na to. It can also develop hydrops fetalis. No? From the name itself, sa fetus pa lang, no, nagkakaroon ng water retention. Kaya makikita nyo sobrang daming or sobrang laki ni baby due to water content. Okay? So, wala nagsusurvive. Kung tatanungin nyo kung buhay ba itong patient na to, wala. No? Hindi ito nagsusurvive sa loob pa lang ng uterus, dead na yung baby. Okay, next, thalassemia is your beta thalassemia caused by low or absent beta globin chain. So, meron tayong minor and major. Kapag isa lang ang beta na absent, minor. Pag yung dalawang beta globin chain ang absent, beta thalassemia major na. In other books, pwede nyo mabasa, no? Other name ng beta thalassemia is Cooley's anemia or Mediterranean Sea anemia. Most common finding in the PBS sa mga thalassemia are your podocytes and target cells. Bakit tinawag na target cell? Kasi meron tayong ganitong formation, no? Wala tayong central pallor. Okay? Meron tayong parang condensed hemoglobin sa gitna ng central pallor. So, yung tinatawag nating target cell. Okay, next hemoglobinopathy is the sickle cell anemia. So, in other books, ang nomenclature or pagsusulat natin dyan is HBSS. HBSA naman, if sickle cell trait. Ibig sabihin, yung isang alpha or yung isang pair ng alpha chain is napalitan ng normal na globin chain. Okay? Isa lang. Kapag dalawa, yung dalawang pair, full-blown sickle cell anemia na ang tawag. Ano naman ang genetic mutation that can be observed in sickle cell anemia? Ang valine will substitute the normal glutamic acid at the 6-amino acid of the beta-globin chain. So, since second year, pinapamemorize ko na to sa inyo. Dapat wala nang magkakamali dito. And another important to take note is that sickle cell anemia confers protection against malaria. So tatlo na ang conditions that can protect us against malaria: G6PD, ovalocytosis, and sickle cell anemia. In this type of condition, ang nireklamo ng pasyente is they are in pain, lalo na sa kanilang mga joints. Ang tawag dun sa painful reaction na yon is what we call vaso-occlusive crisis. Yung mga sickle cell anemia, hindi nakakapag-travel ng mabuti all throughout the capillaries, so nagsastuck sila in one intersection, and this will cause pain in the patient. So, ito yung tinatawag natin vaso-occlusive crisis. And kapag nangyari itong type of crisis na to sa spleen, nagkakaroon ng autosplenectomy or nasisira yung spleen. Therefore, kapag walang blood flow, lumiliit ng kusa yung spleen and namamatay yung spleen. So, tinatawag natin autosplenectomy. And then we will proceed with special diagnostic tests. Unahin natin yung mga tests for sickle cell anemia. The following tests are just for screening test lang. Okay? Kasi obsolete na to, hindi na to masyadong ginagawa in laboratory. So, unahin natin the hemoglobin solubility test or the sodium dithionate test. The principle of the test is that HbS or hemoglobin S has a low solubility when combined with the following reagents: sodium hydrosulfite or the dithionite, which is a reducing agent. It converts your ferrous iron to ferric iron. And saponin, which dissolves the RBC membrane, releasing the hemoglobin. Normally, yung ating mga normal hemoglobin, magkakaroon ng lysis, kumbaga. Okay? And they are not resistant with this type of reagents. Kapag ang RBC mo contains hemoglobin S, resistant in lysis, therefore, turbid ang color of the specimen. So, ma-appreciate natin sila dito. Halimbawa, ito, it contains the normal adult hemoglobin, complete lysis. So, you can see through and through yung paper do sa background. In contrast with the sickle cell, hemoglobin S, which is resistant to lysis. So, very turbid. Hindi mo makikita yung background paper. The next test for sickle cell anemia is the sodium metabisulfite. Parehas lang ito, Pero, hindi lysis ang ginagawa ng metabisulfite. It will cause sickling of the RBC. Lalong-lalo na, ang very vulnerable dyan kapag pangit yung ating hemoglobin content. In cases of sickle cell anemia. Normally, hindi magsisickling ang RBC in a normal patient. If ang RBC mo contains HbS, mas madali ang sickling, it will remove all oxygen from the hemoglobin, shrinking the RBC membrane. So, under microscope, i-observe mo yung iyong results, Meron tayong positive sickling dito. Ibig sabihin, possible na merong hemoglobin S content itong mga RBC na to. Okay? In other books, ang sabi nila, positive holly leaf cells. Ano yung holly leaf ba? So, nakakita ko ng picture sa internet na medyo hindi siya perfect crescent shape. Okay? So, may mga edges yung mga yan. due to sodium metabisulfite. Other less common hemoglobinopathies are as follows. So, tinable ko na sila para mas madaling maintindihan or ma-memorize yung genetic defects ng mga yan. No? Arrange natin sila through this manner. CEO, O Arab. No? In other books, O lang. So, sa Rodax kasi, O Arab ang tawag. And then, hemoglobin D, GM. So, pinagsama-sama ko to kasi halos pare-pareha sila ng pattern, no? Lysine will substitute for glutamic acid at the beta-globin chain and nagkaiba lang dun sa arrangement of the amino acid. Ito, inaapektuhan niya yung 6th amino acid, ang hemoglobin E, 26, hemoglobin O, 121st. So, alphabetically arrange nyo lang, CEO, 6, 26, 121. Okay? The next part naman, yung mga unusual natin, hemoglobin D, ang nangyayari dyan, glutamine will substitute your glutamic acid at 121st beta. Hemoglobin G, si lysine will substitute your asparagine at the 68 at alpha globin chain. And then lastly, your methemoglobinemia is associated with hemoglobin M. Tyrosine will substitute your histidine at 7th or 8th and in every globin chain, no? Alpha, beta, or gamma. And that ends the lecture series for RBC Pathology.